Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into a crucial topic: hypertension, a common companion of insulin resistance. This is part 76 of our ongoing series on health and wellness. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences. Your engagement helps us reach more people with this vital information. Have you ever wondered why hypertension or high blood pressure is often found in individuals with insulin resistance? You're not alone. This intriguing intersection of health conditions is a hot topic in the medical world today. Hypertension, known as the silent killer, is a prevalent condition that can lead to severe health complications. On the other hand, insulin resistance is a metabolic disorder that disrupts the normal functioning of insulin in your body, leading to increased blood sugar levels. When these two conditions collide, it can create a perfect storm for your health. Alarmingly, the coexistence of hypertension and insulin resistance is not as uncommon as you might think. The potential dangers of these conditions are significant, and understanding their relationship is key to effective prevention and management. Today, we are going to delve into the relationship between insulin resistance and hypertension. To fully comprehend how insulin resistance contributes to hypertension, first, we need to understand what insulin resistance is. Insulin resistance is a condition where the body's cells become less responsive to the hormone insulin. This lack of response disrupts the normal metabolic process. The hormone insulin, as we know, plays a pivotal role in controlling the amount of glucose in our bodies. It helps our cells absorb glucose and convert it into the energy we need for our daily activities. But when insulin resistance sets in, this crucial process is hindered. The cell's inability to respond adequately to insulin leads to a higher concentration of glucose in the bloodstream. This excess glucose, in turn, triggers a series of metabolic disturbances. These disturbances not only affect blood sugar levels but also have a significant impact on other aspects of our health, including blood pressure regulation. Now, with a grasp on what insulin resistance is, we can explore how it contributes to hypertension. There are many ways in which insulin resistance can lead to hypertension. To unravel this complex relationship, let's delve into 10 mechanisms that link insulin resistance and hypertension. Firstly, insulin resistance can lead to increased sodium retention. Essentially, when insulin resistance occurs, our kidneys become less effective at flushing out sodium. This increased sodium reabsorption can cause fluid retention and an increase in blood volume, thereby raising blood pressure. Secondly, insulin resistance can overactivate the sympathetic nervous system. This overactivation can lead to an increased heart rate and constriction of blood vessels, both of which can increase blood pressure. Thirdly, we have endothelial dysfunction. The endothelium, the inner lining of our blood vessels, plays a vital role in maintaining blood pressure. Insulin resistance can impair the function of the endothelium, reducing the production of nitric oxide, a molecule that helps our blood vessels relax or dilate. This impaired vasodilation can contribute to hypertension. Fourthly, insulin resistance can trigger chronic low-grade inflammation. This inflammation can contribute to arterial stiffness, a condition that makes it harder for the heart to pump blood through the arteries, leading to high blood pressure. Next, insulin resistance can alter magnesium metabolism. Magnesium is a critical mineral that helps regulate blood pressure. When insulin resistance affects magnesium levels, it can disrupt this regulation and contribute to hypertension. The sixth factor is the increased production of vasoconstrictor substances. Insulin resistance can lead to an increased production of substances like endothelin-1, which constrict blood vessels, thereby raising blood pressure. Seventh, we have the renin-angiotensin-aldosterone system, or RAS. This system helps regulate blood pressure, and insulin resistance can overstimulate it, leading to increased blood pressure. Eighth, insulin resistance can increase oxidative stress. This heightened oxidative stress can damage blood vessels, contributing to hypertension. Ninth, insulin resistance can promote the growth of smooth muscle cells in the walls of arteries, a process known as vascular smooth muscle cell proliferation. This proliferation can narrow blood vessels, making it harder for blood to flow and thus increasing blood pressure. Finally, leptin resistance often accompanies insulin resistance. Leptin is a hormone that helps regulate energy balance and body weight. When leptin resistance occurs, it can contribute to hypertension through various mechanisms, including increased sympathetic nervous system activity and renal sodium retention. These factors show how interconnected insulin resistance and hypertension are. It's clear that our bodies are complex systems where changes in one area can have far-reaching effects. Understanding these connections is the first step towards better health. So stay tuned as we continue to explore this topic in our next segment. Understanding the problem is the first step towards finding a solution. So, what can we do about insulin resistance and hypertension? First and foremost, one of the most effective strategies is adopting the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension, and it's a diet rich in fruits, vegetables, and low-fat dairy products. It's also low in saturated fats, cholesterol, and total fat. This diet has been shown to lower blood pressure significantly in several research studies. The benefits of the DASH diet go beyond just lowering blood pressure. It's nutritious, balanced, and can contribute to overall health. However, it may require significant dietary changes, which might be a challenge for some. Next up, we have regular physical activity. Exercise plays a dual role in managing both insulin resistance and hypertension. It improves insulin sensitivity, helping your body use insulin more effectively, and it also helps lower blood pressure. The benefits of regular physical activity are wide-ranging, extending beyond just metabolic health to mental well-being, cardiovascular fitness, and more. But, of course, it requires consistent effort and a time commitment. Thirdly, weight management. Maintaining a healthy weight is another powerful strategy to improve both insulin sensitivity and blood pressure. Excess weight, particularly around the abdomen, is linked to insulin resistance, while losing weight can improve insulin sensitivity. Similarly, weight loss has been shown to lower blood pressure. The benefits of weight management extend to overall health, including reducing the risk of various diseases. However, achieving and maintaining a healthy weight can be challenging for some individuals, requiring sustained effort and potentially significant lifestyle changes. Finally, stress reduction. Chronic stress contributes to both insulin resistance and hypertension. When you're stressed, your body releases hormones that can increase your blood sugar and blood pressure. Techniques for managing stress can include mindfulness practices, yoga, deep breathing, and other relaxation techniques. Stress reduction not only helps manage insulin resistance and hypertension, but it also improves overall well-being. However, it can be challenging to find effective stress reduction strategies and integrate them into a busy lifestyle. In conclusion, managing insulin resistance and hypertension involves a multifaceted approach, including dietary changes, regular physical activity, weight management, and stress reduction. Each of these strategies has its own set of challenges, but they also offer a wide range of health benefits. It's important to remember that everyone is unique, and what works well for one person may not work as well for another. It's about finding a balanced approach that works for you and your lifestyle. With these strategies, we can effectively manage insulin resistance and hypertension, leading to a healthier and more vibrant life. To sum up, hypertension and insulin resistance often go hand in hand. But armed with knowledge and commitment, we can tackle these health challenges. The concept of insulin resistance and its intricate relationship with hypertension is a topic of paramount importance. Understanding this connection allows us to take proactive measures and make informed decisions about our health. Insulin resistance is a condition in which our body cells fail to respond effectively to the hormone insulin. This inefficiency leads to elevated blood sugar levels and a cascade of metabolic disturbances. These disturbances, in turn, can directly and indirectly affect our blood pressure regulation. We discussed 10 ways in which insulin resistance can contribute to hypertension, from increased sodium retention and sympathetic nervous system activation to inflammation, altered magnesium metabolism, and more. However, it's not all doom and gloom. There's a silver lining. We can manage and even prevent these conditions. A healthy lifestyle is our first line of defense. The DASH diet, for instance, rich in fruits, vegetables, and low-fat dairy, has been shown to lower blood pressure. Regular physical activity improves insulin sensitivity and helps lower blood pressure. Weight management too is crucial, as maintaining a healthy weight can improve both insulin sensitivity and blood pressure. And let's not forget the importance of stress reduction. Chronic stress contributes to both insulin resistance and hypertension. So, finding ways to relax and unwind is vital for our health. It's clear that our lifestyle choices play a significant role in managing insulin resistance and hypertension. But remember, everyone's journey is unique. What works for one person might not work for another. As we wrap up, I want to emphasize the importance of addressing both insulin resistance and hypertension. By taking steps to improve insulin sensitivity and manage blood pressure, we can significantly reduce our risk of serious health complications. Before we conclude, I must provide a brief disclaimer. The information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your individual situation may require specific medical attention, and it's crucial to seek professional advice for personalized care. Thank you for joining me in the Victory Education Lounge. If you found this information helpful, please remember to like, subscribe, and share your thoughts in the comments. Your experiences and questions can help others on their health journey. Until next time, this is Maurice, wishing you health, vitality, and optimal blood pressure.